Hello everyone, we are presenting about our innovative solution regarding the problem postpartum hemorrhage. So our product name is Jojari. So the teammates are Dr. Aravind, Dr. Srivatsam and Dr. Ashish Kumar. So the main target audience for our product is the mothers with high risk for postpartum hemorrhage, those who have prolonged third stage of labor, multiple deliveries, episiotomy, fetal macrosomia, history of postpartum hemorrhage, multiparity, and placenta previa, placental abrasion, and pregnancy-induced hypertension and infection. So the current scenario is during the stage 1 of shock, usually the patient is asymptomatic, but in stage 2 only the heart rate is increased, and in stage 3 there is heart rate and hypertension along with the symptoms like confusion and lethargy. In current scenario of postpartum hemorrhage, we are able to identify only at stage 2 and stage 3. So by this time the patient have already lost about more than 15 to 30% of blood. So the incidence of postpartum hemorrhage in India is about 3 to 6%, and it is the most common cause of maternal death, and it is also the avoidable cause of maternal death. About 80% of it can be avoided. So the problem statement, we are telling it in the form of a clinical scenario. A 24-year-old female who is a gravida 2, para 2 and live 1 with a previous history of postpartum hemorrhage and prolonged third stage of labor delivered a baby by normal vaginal delivery. The patient was shifted to ward after 2 hours of observation. In ward, her initial vitals, the BP was normal and the pulse rate was little bit on the higher side, and the respiratory rate was also little bit on the higher side. 2 hours later, the patient was found to have altered sensorium. This was informed to the nurses by the attendant. Then the nurses checked the vitals of the patient. By the time they found the BP has also dropped and the heart rate and the respiratory rate has increased. So in this clinical scenario, the patient is a high risk patient for postpartum hemorrhage. There's a previous history of postpartum hemorrhage. There's a prolonged history of prolonged third stage of the labor, and all these times initially when she was shifted to ward, she was in stage 1 of shock when the pulse rate is high. Then finally the diagnosis was made only at the stage 3 of shock, where the patient have already lost more than 30% of the blood. So the current problem is we are not able to predict the postpartum hemorrhage at an early stage. So WHO states that around 14 million women experience postpartum hemorrhage every year, and it results in about 75,000 of maternal deaths globally. So the solution what we are proposing is a wearable device for continuous monitoring of the patients in the vitals in the post-operative period or post-delivery period. So if you use such monitoring technologies like heart rate and BP, we will be able to find the disease only after a minimum of 15% of blood loss has occurred. So based on the principle of continuous non-invasive hemoglobin monitoring, we are providing a wearable device technology through which we can diagnose whether the patient is losing the blood or not at an early stage, even before 15% of blood loss has occurred. So we can suspect that thing and we can make a decision earlier. So the main features are, it is easy to wear. It's not like other monitoring system which is connected to a big monitor through wires. So the patient is comfortable. She can sleep along with that for over the 24 hours. She can roll over the bed. Everything can be done, and it will be integrated through mobile apps for remote monitoring. So if the doctor is not also available, he can, if the 10 patients have delivered in the ward, he will get notifications if some of the patients are at a critical level of blood has been lost. So and also it is economical and it is based on the principle of photospectrometry. So how it will be helpful? So it helps in the continuous monitoring, and complications can be detected earlier, and it improves patient safety, and cost can be optimized, and it is convenient for the patient. It is not troublesome to wear 24 hours or 48 hours or even more. So the current market players in this field are digital postpartum hemorrhage monitoring device. It mainly works on the principles of heart rate and blood pressure. So as I have already said, the heart rate changes occur only in the stage 2 of hemorrhagic shock, and in blood pressure changes occurs only in the stage 3. If we detect at this stage, it will be very late. So all other marketing devices which are available are working towards this stage, but the proposed system which we have set we will be able to identify the stage of shock at much earlier stage. So the main business model is, so as far as the foreign data is concerned, if there is a secondary PPH, the average cost of a patient is $2,622 per patient, but a patient without postpartum hemorrhage, the normal cost is only $2,275. The cost is almost 10 times multiplied. So when it comes to India, for postpartum hemorrhage alone, the cost is around about 6,500. But with this wearable device technology, they have some only an initial investment, capital investment, followed by that the running cost will be much lesser, and it will be similar to the other monitoring systems which we are investing, and it will be cost effective than the usual monitors which we have. So, and the main customer base is business to business, hospitals and clinics, and the wearable sensor market has a in 2024 it is a market worth of $4.36 billion, and in this the wearable market device in the post-operative monitoring and the patient monitoring systems is much lesser, and it is highly growing. So this is the current business model. Thank you.